the screens on Facebook, YouTube, and Instagram. And see our special guest who is joining us in the studio today, Dr. Subrine, who is currently practicing at St. Augustine's Hospital in Durban after many years of practicing in Johannesburg. The ethos of this practice is to encourage education and female empowerment, assisting women in making individualized health. Now, I like that. Now, in South Africa, ovarian cancer is a significant health concern, though it is relatively rare compared to the other cancers affecting women. So to tell us more about this type of cancer, Doctor is going to be sharing that with us. Dr. Maurice, welcome to Urban Women. It's absolutely wonderful to have you on with us this morning.
Thanks so much for inviting me. I'm so happy to speak about something that doesn't get as much airtime as it should, and I'd really like for all our listeners to have more awareness and education about it.
And of course, knowledge is power. Knowledge
That's
is
it.
key. Ignorance is not bliss. I have to say that. I always say that
Absolutely.
because often women are afraid. If something pops up that doesn't belong in the body, we don't want to check it out because what we may find out, rather we not know. So I think information is so important. But before we jump into it, tell us a little bit about yourself. We know that you're a very vibrant type of a doctor and personality. Just share with us a little bit about yourself.
I'm an obstetrician, I'm a gynecologist, but more important than that, I'm one of the girls. You don't have to feel afraid and uncomfortable about discussing anything about your health, your gynae life, or even your sex life.
Mm-hmm.
I manage patients from little girls all the way up to the old grannies.
Mm-hmm.
And a little fun fact about me is that I'm also one of the spa ladies ambassadors.
Fantastic.
And that helps me to keep fit, be involved in healthcare that isn't just specific to gynecology.
It's all tied in. So
That's
it's so
it.
beautiful. You bring it all in so wonderfully. Now elaborate a little bit more about ovarian cancer. What exactly is it? Share that with us.
So a cancer can happen anywhere in the body, but cancer is an abnormal growth of cells. These cells have now learnt that they can be uncontrollable and grow around the body.
Mm-hmm.
And specifically with the ovary, it has 3 different parts. Part 1 is the outer shell. That's the epithelium. Then we've got the eggs. Those would grow into babies.
Mm-hmm.
And the third part is where your hormones are created. And each one of these places can grow into a different kind of cancer, but we would still call all 3 kinds ovarian cancer.
Thank you so much for explaining that in a way that we can, understand so nicely. What are some of the most common symptoms of ovarian cancer, especially us South African women can be on the lookout for and recognize?
The scary thing is that ovarian cancer can seem like nothing at all. The symptoms are usually quite non-specific.
Mm-hmm.
These are things like bloating. You might start to feel very full because the stomach has such a small area to work with because of a growing ovary. Ladies might have the abdomen full with water, or they might find that their waist is becoming much larger than it used to be.
Okay.
Other ladies can have difficulty with urinating, difficulty with passing poo. This is all changes that are happening within the pelvis. And a very important one, especially in postmenopausal ladies, is if they suddenly have vaginal bleeding after menopause. And that's usually from the estrogen created from the ovarian cancer, but it's even causing the period to grow back.
Wow. So if we have any of this, abnormal, any of these, please check it out. Don't think that it's going to pass. Check it out and know for sure. Get that peace of mind. Why are ovarian cancer survival rates lower amongst Black women in South Africa compared to other racial groups?
There are a lot of different factors that cause this. Number 1, ovarian cancer is more commonly found in the white community. And so awareness is among them.
Right.
And there's less awareness or thought that you are invincible if you're any other race.
Okay.
Also, a larger proportion of Black ladies in the South African country only would access public health care compared to private health care, where there's a lot less screening, and we're probably only finding these cancers quite late.
Mm-hmm.
A lot of the research that's been done and the medications used, those studies were done in the European or American settings where Black women were not the majority patients.
Mm-hmm.
So even though we are using these medications, they may not be best suited to the genetics of a Black woman.
There we go. Yeah, it's so true. We have different kind of genetics. And what screening and diagnostic services are available for ovarian cancer in South Africa, particularly in rural areas?
In rural areas, there's simply not enough. In rural areas, you may have a single GP and not even gynecology services, or you may just have a little public clinic, and they don't have the expertise to be able to screen correctly for ovarian cancer. So we need our patients to advocate for themselves to be referred to a higher facility that has a gynae clinic or a gynecologist, so they can access ultrasounds or other forms of blood tests like tumor markers. We want to be
Right.
able to have someone who can examine the abdomen and the vaginal area that is comfortable and experienced with ovarian abnormalities.
So important. And what role would you say that organizations like CANSA play in raising awareness and supporting ovarian cancer patients in South Africa?
They are so important. And for me, if I break it away from being a gynecologist, both my parents had cancer.
Okay.
And those organizations, up to this day, still help me to see the goodness in having cancer.
Oh, wow.
It's the connection between the general public and the medical treatments and the oncologists. Just recently, I was involved in Cupcakes for Cancer, which was about 75 malls around KZN that were selling cupcakes to raise money for cancer treatments. So whether you're involved in cancer as yourself as a patient, as a family member, as a doctor, or even as just a person living in South Africa, you can still, through these organizations, contribute to people having screening, being diagnosed, or getting the correct treatment.
Wow. So you basically have first-hand experience. You would know what
Absolutely.
the families feel. You would know what the journey entails, and you would be able to assist from here, not just your knowledge of it. I think that creates such a profound effect, especially when you have this kind of a doctor helping
Yeah, it
you.
definitely helps me to know what to say to the family members and the patients,
Correct.
because I know the things that I wished somebody would have said to me in those times.
That's very true, because often we hear, when it comes to all the specialists, they'll give you a one-word answer. And the irony is, like, when we chat to amongst us laymen, it's like, but we haven't studied it. We don't have the knowledge you have. Don't respond with the one-liner and expect us to know, because certain things are so critical. It's like, life depends on it. So what is your take on whole message for our urban women listeners this morning, Dr. Maurice?
Ovarian cancer cannot be found in your home just with you. You need to prioritize seeing your gynae for annual checkups or being referred from a clinic to a higher facility so that we can know if something is going wrong. Don't ignore symptoms. Go and get a checkup, because 99% of the time, it's nothing.
There we go. So it's the fear, right? It's often the fear. Our mind is so powerful. That's my kind of work, dealing with the mind. But absolutely, it's nothing. So if many of you would like to contact and visit Dr. Maurice, if you can see she's a pleasant person, easy to talk with, then she is at her practice is at Parklands Hospital.
At St. Augustine's Hospital.
St. Augustine's. Good thing I mentioned it, St. Augustine's Hospital. Would you like to share your contact details while here with us?
Sure. So the number for the practice is 072 072 2058. You can also get us on email at info@subrian.co.za. And if you just want to learn more, please check out my TikTok, Facebook, and Instagram pages, where you can get a lot of gynecology information.
Thank you so much. Thank you. We appreciate your time. We know how busy you are, but thank you so much for sharing this very important information with us, urban women. And until we connect again, have yourself a lovely day further.
You too. Enjoy.
Thank you so much. Bye for now.
رسول إمام بنور الصف